What do you really know about anorexia? It's a word we've all heard, a term often used loosely in casual conversation, but it's so much more than a simple label. Anorexia is a complex disorder that goes far beyond the common stereotypes and misconceptions. It's a life-altering condition that can affect anyone, regardless of age or gender, and understanding it is crucial. This disorder is not just about skipping meals or having a distorted body image. It's a deep-seated psychological issue with physical manifestations that can lead to serious health implications. Understanding anorexia is not only vital for medical professionals who are on the front lines of diagnosis and treatment, but also for all of us. We all have a role to play in recognizing the signs, providing support, and breaking down the stigma attached to this disorder. So let's dive deeper into the world of anorexia. Let's unravel its complexities, its causes, its symptoms, and its potential treatments. Let's learn together. To truly understand anorexia, we must first define it. Anorexia nervosa, often simply referred to as anorexia, is a psychological eating disorder defined by an intense fear of gaining weight, leading to self-starvation and excessive weight loss. It's not merely a diet gone wrong or a desire to look thin. Rather, it's a complex condition that intertwines both mental and physical health. From a medical perspective, anorexia is characterized by a body weight that is significantly lower than what is considered healthy for a person's height and age. On a psychological level, it's a condition that's often accompanied by a distorted body image and an obsessive fear of gaining weight, even when severely underweight. It's a disorder that impacts not just the body, but the mind and soul as well, leading to a myriad of health complications if left untreated. Now that we know what anorexia is, let's discuss its symptoms. Anorexia is more than just a desire to be thin. The symptoms can be complex and varied. One of the most apparent signs is a distorted body image, where individuals may see themselves as overweight, even when they are clearly underweight. This skewed perception can lead to extreme dieting and excessive exercise. Another common symptom is a preoccupation with food, dieting, and body size. It's not unusual for individuals battling anorexia to obsess over calorie intake, spend hours thinking about food, or engage in ritualistic eating behaviors. Physical symptoms are also a telltale sign. These can include severe weight loss, fatigue, insomnia, dizziness, and in some cases, a cessation of menstruation. Mental health issues often accompany anorexia. Depression, anxiety, and feelings of worthlessness or guilt are not uncommon. Lastly, social withdrawal is often seen. Individuals may isolate themselves, avoiding meals with others or social activities that involve food. These symptoms can be alarming, but what causes anorexia in the first place? Anorexia doesn't just happen, it has causes, some of which might surprise you. Let's dive into the deep end and explore 5 different causes of anorexia. Firstly, genetics plays a significant role. Just like you might inherit your dad's sense of humor or your mum's bright blue eyes, the susceptibility to anorexia can also be passed down through generations. But it's not as simple as carrying a single anorexia gene. It's a complex interplay of multiple genes that influence our behaviors, emotions, and responses. Secondly, consider the environment. We live in a world that often idealizes thinness and demonizes fat. This societal pressure can push some individuals towards an unhealthy relationship with food and body image. Thirdly, let's talk about psychological factors. Personality traits like perfectionism, rigidity, and neuroticism have been associated with a higher risk of developing anorexia. It's like a cruel trick of the mind, where the pursuit of perfect becomes a dangerous obsession. Fourthly, other mental health issues often walk hand in hand with anorexia. Depression, anxiety, and obsessive-compulsive disorder are some of the frequent companions of this eating disorder. Lastly, we can't overlook the role of traumatic experiences. Events like bullying, abuse, or a significant loss can act as a trigger, setting off a chain reaction that leads to anorexia. Understanding the causes is crucial, but what happens when anorexia goes untreated? Let's find out in the next part of our discussion. Anorexia is a serious disorder and can lead to severe complications if not addressed. It's not just about the weight or the food, it's a complex mental health condition with potentially dangerous implications. First, let's talk about the heart. Anorexia can lead to a slow heart rate and low blood pressure, which can cause the heart to fail. Imagine the heart, the engine of your body, struggling to keep up with the demands of daily life. Next, there's the bone damage. Anorexia can lead to osteoporosis, a condition where your bones become brittle and fragile. It's like living in a house with crumbling foundations, and it's not a place anyone would want to be. Then we have the fertility issues. Women with anorexia may stop menstruating, and men may experience a decrease in testosterone. It's like a biological clock, suddenly deciding to stop ticking. Moving on to the fourth complication, we have the brain. Anorexia can lead to problems with concentration and decision-making, affecting every aspect of a person's life. It's like a fog settling over your mind, obscuring your thoughts and actions. Lastly, there's the risk of multi-organ failure. Anorexia can affect almost every organ in the body, leading to a variety of complications that can be life-threatening. It's like a domino effect, where one small push can cause the entire system to collapse. It's clear that anorexia can have serious consequences, but can it be prevented? Prevention is always better than cure, and anorexia is no exception. Let's delve into 5 potential prevention strategies. First, early education about healthy eating habits can be a game changer. Teaching children and adolescents about the value of nutrition and the importance of balanced meals can set a foundation for a healthy relationship with food. Second, promoting a positive body image is crucial. Let's challenge societal beauty standards that glorify thinness and promote acceptance of all body types. Third, mental health support cannot be underestimated. Regular check-ins with mental health professionals and open conversations about self-esteem and body image can be preventive measures against developing anorexia. Fourth, families and friends should be educated to spot early warning signs. Lastly, regular physical checkups can identify any concerning weight loss early on. While prevention is crucial, treatment is key for those already battling anorexia. Treating anorexia involves more than just eating more. It's a comprehensive process. Let's delve into 5 key treatment methods. First, we have medical treatment. This is crucial to address any immediate health risks and restore the individual's body to a healthy state. It can involve regular checkups, nutritional supplements, and possibly hospitalization in severe cases. Next, we have psychotherapy. Cognitive behavioral therapy, or CBT, is commonly used. It helps individuals challenge their distorted thoughts about weight and body image and develop healthier eating habits. Thirdly, there's family-based treatment. This is especially relevant for adolescents with anorexia. The family is involved in the recovery process, helping to maintain a healthy, supportive environment at home. The fourth method is medication. While there's no specific drug to treat anorexia, antidepressants or anti-anxiety medications can be used to manage co-occurring conditions such as depression or anxiety. Lastly, we have support groups. These provide a safe space for individuals to share their experiences and gain strength from others who are on the same journey. Remember, no one should face anorexia alone. Each of these methods is important in its own right, but the most effective treatment often involves a combination of them. It's crucial to remember that everyone's journey with anorexia is unique, and treatment should be tailored to fit the individual's specific needs, addressing both their physical and mental health. Treatment can be a lifeline for those with anorexia. It's a journey, not a quick fix. Anorexia is a complex disorder, but understanding it is the first step towards combating it. We've delved into its definition, identified the symptoms, explored the causes, and discussed the potential complications. We've also highlighted the measures for prevention and treatment, all aimed at providing a comprehensive understanding. This knowledge equips us to identify, intervene, and support those affected, fostering a healthier future for everyone. Remember, knowledge is power. And in the case of anorexia, it can also be a lifesaver.